Welcome to Life Begins at 50 on KDKA TV. I'm your host, Carol Lee Espy, and today we're featuring 5 excellent tri-state area businesses. Coming up, Thomas Young from First Consultants will help you manage your investments. And Dr. Tony DeCesaro from Whitehall Health Center and Laser Spa will help you with laser therapy. Cookie Harris from New Image Hair Clinic will help you look years younger with a makeover for your thinning hair. And Dr. Nathan Lockery from Aspen Dental will tell you all about the latest in dentistry. But right now, let's welcome Joanne Gago from Life Pittsburgh. Welcome to Life Begins at 50.
Oh, Carol, thank you.
Joanne, what is Life Pittsburgh?
Well, Life Pittsburgh is a program that was designed to help support older adults who would normally be considered nursing home eligible,
right,
to remain in their own homes and communities as long as we possibly can, and hopefully till the that's their last stop.
Yeah. Now we have a huge aging population in Pittsburgh and Allegheny County. What were you saying? The statistics alone are
they're pretty breathtaking. Yes, 250,000 older adults over the age of 55 in this community are at various stages of disability and aging. Some are doing it a little better than others, but those that are finding themselves repeatedly going to the doctor and repeatedly needing services, help for things, are the ones we're really kind of trying to get to.
And you're saying this is so that they stay at home and are somewhat independent, but still need care.
Right. Right. I think one of the things that strikes me is many people talk about that last event that happened to their elder parent, and to be honest, that sometimes is the sign that they're not going to recover from that. Our job is to try to find people a little bit before that, so that we can try to put the correct supports in their home and get them the right medical care, the right medication management. Because some of the simplest things are really some of the hardest things. Life Pittsburgh's whole concept is to keep that nursing facility eligible, so that person that's that complex in their own home. And it's really not for the average person who just can't do their lawn work. This is the person who really needs medical intervention, and they need some assistance with their activities of their daily living. So
who's eligible for this?
Well, this is typically an over 55-year-old person. So our average age at Life Pittsburgh is 55 to 101 is the oldest we have at the moment. And a person typically is someone who, by definition, is eligible for a nursing home. And by that, I mean they can't really get to their activities of daily living easily, or they need some assistance to do that. Some people are really quite complex and really can't do any of that. I was astounded to know, frankly, that when I first started the program back in '99, that about a third of the people are really underfed, because it's not that they can't get the food. They can get the food, they just can't prepare it, or maybe they can't quite get it to their home. So it's somebody who just can't get to those daily things that they must do to keep themselves healthy and well.
And how is this paid for? How are the costs managed?
Well, the state government, as we know, we went through quite a time this year with the budget, but the state government recognizes that it is sort of an entitlement program, if you will, as a nursing home, at the point of Medicaid paying for that after the person's sort of out of assets and resources. So the program is supported by both Medicare and Medicaid, and they pay a capitated membership fee, if you will, per member per month, to keep this person as healthy and well in their own home as is possible. So this is how it works. So
is it saving money?
It does. It does indeed. This is significantly discounted for the state government and even for the federal government under Medicare, because we're controlling and managing the care the person has. You may know, if you've ever done this, even for yourself. You go to one doctor or another doctor or another doctor. You may have an eye doctor and a foot doctor and a regular general practitioner. Those, though we think magically those all talk, they don't necessarily talk. So this is the coordination of care.
Centralized care.
And to try to keep someone as healthy as possible as they continue to age with many chronic conditions. To say a little more about who's eligible, typically it's someone who has 4 or 5 medical conditions, chronic medical conditions, diabetes, heart disease, arthritis, limitations in their activity or their mobility. It's someone who you might imagine would be in need of a nursing home. The part that's kind of key here, Carol, is that we've seen for a long time that many people understand if they get really sick and go to the hospital, they may never get to go home again.
That's a big fear of elderly folk, and rightfully so. They feel like that, and there's a decline
Right.
And how they try to survive afterwards.
Correct.
Yeah.
There's not, sometimes they don't have the reserve that you think, well, they were so well before this happened, and they should be able to bounce back, but that's not really true. Where we like to say is we'd like to see those people come to our door if they can earlier, so that we can enroll them, keep them healthy and safe, make sure their home is a little bit safety. You can't make it perfect, but there is no perfect setting for someone. So our goal is to get in the home, try to help the person get managed and get their medical care under control, and do that as early as possible, sometimes earlier than you think. It's not after that last event, although we're perfectly fine for that as well. Right. But it can be well before that last event that happens. Where
is this available? Is this just locally, or?
Actually, it's in the surrounding area, a lot more than it has been in the past. Allegheny County is pretty covered. There are 2 programs. Ours is on the western half of Allegheny County, and in the surrounding locale, you can find this program through calling our number, which is that 388-8050, which I know is on the screen.
It's on the screen and your website also.
Yes, as well.
Now, the services that you provide, we're also going to scroll that on the screen.
Yes, great.
So many different services too, the long-term health coverage and care at home. Also physical and occupational therapy, that's pretty big too.
Right. If I can just sort of, not to make a list, but to sort of speak of that, our medical care, so we hire physicians and nurses to help manage your meds and all of the other treatments you might need. Therapists, physical and occupational therapy, you can get speech therapy as well.
Which is a big thing. There's a lot of falls in the home.
Correct. And some of this is just a matter of proofing your home, if you will, throw rugs.
Bathrooms ready. Get rid of those throw rugs.
Right, exactly. Cords across the floor, things that seem like they've been there forever, but
now it's not a good idea.
Right, pets for that matter. You don't get rid of the pet, you just figure out the way to get the pet out of the footwork of the person.
Out of your pathway.
Exactly.
I trip over my dog all the time now as it is.
It is.
That's one of those things. This was inspired by your mom.
Yes, it was inspired by my mother. Yeah, she was. Well, this is a woman who was for lack of using a very old word, persnickety. She just didn't really want a lot of medical care, and she didn't want a lot of intervention. She wanted to be on minimal medications
and wanted to be at home.
And she really wanted to be at home. Don't tell her she's going to go anywhere.
Yeah.
So I think much of this program is designed for that person who would like to just be, if they can, as free as they can to do what it is they want to do in their aging years, with some assistance and help from us.
Exactly. And you have, and she would be a success story, would you say?
I would think she'd be a great success story. But many of our people, we've, over the years that I've been doing this, found people who have been in and out of the hospital every 30 days, every 20 days, congestive heart failure or something that would be out of their control, or at least they didn't quite understand how to help manage that at home.
Right.
And we'll do that. Person may have been in the hospital 10 times in the past year. We'll bring them in the program, and then they'll find that with the intervention, coming to our adult day center, which we have 3 of those right now.
The socialization is
coming
important.
in, seeing people, seeing their nurse more often, having the intervention of other professionals into their lives. Social workers are very helpful here to help them to sort of gain confidence in their aging, because sometimes it's just a frightening experience to be alone and be failing and not able to do the things you could do before.
This sounds like a wonderful program, Joanne.
Well,
Life
thank you,
Pittsburgh,
Carol.
and thank you for being here.
You're very welcome. Thank you.
Now, if you'd like to know more about Life Pittsburgh, just give Joanne a call at 412-388-8050, or you can log on to lifepittsburgh.org. Now, if you'd like to advertise your product or service on Life Begins at 50, give us a call at 412-575-2400, or you can email us at showcase@kdka.com. Up next, we'll talk to Thomas W. Young from First Consultants. He's going to help you manage your investments. And that's next when Life Begins at 50 continues.